Hi, everybody. Jean Ketchum, Aging but Dangerous. And I have a guest with me today that I am so excited to talk to because, oh my gosh, does she ever have information for us on so many subjects that we need to know about? Her name is Dr. Emily Downing. She is a geriatrician and a system clinical officer. And I had to read that, but welcome, Dr. Downing.
Thanks so much for having me.
Well, can you tell us what all that means, that little introduction, your little title and all that? Can you explain that to us?
Yeah, so I am a doctor who specializes in care of the aging. And right now, I have the opportunity to also be a leader at the Bladder Health care system. So, in addition to being a specialist in care of the aging, I do health system leadership.
Oh, that sounds good. So we're going to talk today about aging well,
Yeah,
right?
we are, yes, and just
Okay.
excited to talk with you all. Just wanted to start with our core principles at Alina Health, and our mission is to deliver whole person care. And what that means is really understanding that all aspects of well being contribute to your health: mind, body, spirit, and community. And certainly as you age, this becomes maybe even more important than when you're really independent and strong in everything on your own. And so I'm going to talk a little bit about, through the lens of whole person care, some tidbits, some do's, and maybe some things to avoid on how to age well.
Well, that's the best subject in the world. That's what we all want to know, is how to age well.
It's surprisingly hard, I think.
It
Uh,
is.
Getting older, I've heard, is kind of challenging.
Yeah, wait till you get there. Wait till you get there, Dr. Downing. Okay, go ahead.
So I'm going to start with some things about your body as you age, starting with bone and muscle health. So some things you should consider doing: consider exercising. Focus on getting your heart rate up to a safe but effective rate. So
And how do we know what that is?
yeah, so that kind of sweet spot is probably in that, heart rate of 100 to 120. That's kind of low intensity cardiovascular exercise. So if you happen to have one of those little Fitbit things or those little watches that check your heart rate, probably in that 100 to 120 range. Um, once you start getting up to running, unless you're already fit and trained, you can go higher. But if you're just
Okay.
starting, 100 to 120.
Okay, perfect. Thank you. Okay.
Yeah. Strength training, and you don't need to lift heavy weights. Just using your body as your own weight, and we call that calisthenics. So that's a fancy word for things like uh, doing lunges, or doing push-ups, or trying to even knee push-ups, using your body as the weight. Balance exercises, so things like yoga or tai chi, and those do not have to be you do not have to be an expert to get benefit. So just trying to do those activities is helpful even if you've never done them before.
Mm-hmm.
Vitamin D in your diet, that is good for your bones. And then getting a DEXA scan, especially if you're a woman over 65, to get screened for reduced bone strength.
Mm-hmm. That is so important.
Yeah. And maybe some things to avoid. So, exercises that cause flare up of previous injuries. Sometimes people want to kind of push through pain. And while, you might get a gold medal, you probably might hurt yourself. So, doing things that are going to flare up old injuries, maybe not a great choice. Lifting heavy weights, your tendons get weaker as you age, and that's why we recommend doing things like calisthenics as opposed to like heavy weightlifting. Pushing yourself too soon, too fast. Um, Take it easy and listen to your body. Don't forget to exercise, and then try to, if you need to, It's okay to use a cane or a walker to prevent falls.
And you know what, Dr. Downing, that is the one thing that women fight is I have a friend that right now the doctor's saying use a walker and she's going, I'm not using a walker. So I think that whole mental attitude is so important because, if you need a cane, I said, you know what, we'll get you a sexy little cane, with rhinestones or something. And she said, there is not a cane that is sexy. And I'm like, no, no, we can make this happen. So I do think women, and we are an organization for women, but I do think they fight that. They fight that walker and that cane, and they need it, and they should just give into it and deal with it.
That's right. There's no medals for falling down,
Right. Exactly. Okay.
All right, gonna move on to some facts about bladder health. So this probably is an issue for most. Things you should do: drink lots of water. That's a little bit counterintuitive, but the less or the so if your urine is really condensed, it irritates your bladder and it's going to cause you to have actually more urgency. So drinking more water to have more dilute or less dense urine is helpful.
So how much water do you think? Because I keep hearing, you don't have to drink 8 ounces of water, or whatever it is, a day. What do you suggest?
Definitely more than 8 ounces of water a day for
Oh,
sure.
yeah, I didn't mean that. 8 ounces times eight,
Yeah, times
64
eight,
ounces.
64
Yeah.
ounces. Yeah, 64 ounces does not have to all be water. 64 ounces of fluid a day for sure.
Oh,
And somewhere between 64 and 128 ounces of fluid is ideal. I recommend half of that be water,
okay.
unless, of course, your doctor has told you another reason that that is not safe for you.
Okay, that's fabulous. Thank you for that. Because we always think it's just the water, but thank you. That can be fluid okay, that was good. Okay.
Yeah, intentionally practicing bladder control. So, one of the ways to do that, and often we think about this as not peeing when you have the urge to pee. So, trying to stop yourself if you have an urge to pee. The other way to do it is going to the bathroom when you don't have an urge and practicing your circuits so that your brain tells your body to pee, right? Sometimes we forget that it works both ways.
Hmm.
So taking yourself to the bathroom and focusing on your bladder, your brain telling your bladder to urinate as opposed to your bladder being the driver, can be really helpful. Addressing external irritation. So as you have gone through menopause, you may have some of that tissue down there or irritation around where your pee comes out.
Yeah.
And there are ways, and that can cause you to have that urgency as well. And so, talking to your doctor about that can help your urgency. And then, of course, talking to your doctor if you have severe symptoms.
And what would you consider severe symptoms?
I think things that are really aggressively interfering with your daily life. So,
Oh, okay.
if you're thinking, I'm not going to go out, or I'm not going to, gosh,
Mm-hmm.
I'm in pain, or,
Right.
things like that, that would be a reason to talk to your doctor.
Okay. Okay, good. Thank you. Yeah.
Some things to avoid: drinking a lot of fluids within the 2 hours before sleeping. Um, especially if you're one who is already getting up during the night quite a few times to go to the bathroom. So while we say drink lots of water, stop doing that 2 hours before you go to bed. Rushing to the bathroom every time you feel an urge.
Hmm.
So this is where that bladder training comes in play, especially if you're just at home and you're like, ooh, I gotta go. Focusing on using your brain to try to soothe that urge, and then getting up and going to the bathroom once that urge has gone away. That's a
Mm-hmm.
good training exercise. And then avoiding bladder irritants, coffee, alcohol, acidic beverages. And it doesn't have to be full avoidance, but maybe not doing all of them all at the same time, or reducing the amount. can be helpful.
Do you know if that rushing to the bathroom every time you feel an urge? I mean, that is so, I find that I do that. It's like, okay, I have an urge, I wake up the night, I have an urge to go, I run to the bathroom. So that is really good to know. I think a lot of times I can avoid that and not go. So that's
Yeah,
good.
and you can still go, but even just counting to 30 and waiting for that urge to pass and then
Yeah.
getting up and going to the bathroom
Okay, that's
can be
good.
helpful.
Okay, good.
Weight, another probably common
Here we
topic.
go. Here we go.
I try to get all the good topics in.
Yeah, you're like hitting all the buttons.
So some do's. So do aim to have a healthy body mass index. And so your body mass index is your overall weight compared to your how tall you are, basically, right? So
Yeah.
obviously your goal weight varies based on how tall you are. And I say a healthy body mass index because you don't want to be too low or too high. And you could struggle on either end of the spectrum as you age. And being underweight puts you at higher risk just as much as being overweight does, although for different, potentially different things. Ways to do that, and I would say a good healthy body mass index for someone who's older is usually around 25 to 28.
It is? I thought it was like 30. No?
Uh, 30 is probably still
Hi.
okay. It's a it's not bad. 30 isn't bad. 25 to 30 could be a good range.
Okay,
Uh,
that's what I'm gonna write down is 25 to 30, because I think I am definitely 30, maybe a couple of points more. So, okay, good.
how you can accomplish that. So maintaining a healthy exercise plan. We talked about that a little. Using
Mhm,
trusted weight loss support programs. So things like Weight Watchers. That is a good one.
mhm.
Make sure they're trusted. Enlisting support and accountability from your friends and family. And if you're underweight, ensure you have enough calories and protein in your diet.
Mhm. Doesn't that pertain to overweight though too? Because you can be overweight and not have enough protein and stuff in your diet, right? I mean, I think sometimes when we are overweight, we gain weight because we're eating all the wrong things and not getting enough of the protein and stuff like that.
I think that's very true. Yes.
Okay.
Maybe that gets to one of the things to avoid here, which is avoiding excess carbohydrates. So breads, chips, crackers,
Yeah.
sweets. Certainly, substituting proteins, good solid proteins in place of those is
Yeah.
a really good strategy. Um, and so, yes, protein is important no matter what. For if you're underweight, not having enough protein can put your muscles and your muscles especially kind of at risk. So it's especially important if you're underweight.
Mm-hmm.
Other a couple other things just to avoid um, fad diets. So try to avoid the stuff you see just in magazines that really isn't fully proven or offers a fast solution. And doing it alone, it's really hard, especially actually both gaining weight for those who may be really underweight or losing weight is really hard to do alone.
Mm-hmm. Yes, it is. It is. Now, this is just a little personal question, and I know you're not in the you're not in this particular area, but the keto diet, is that something to avoid, you think, in your personal opinion?
Um, I my personal opinion is yes.
Okay,
I prefer diets that really offer a good broad approach to balance in your diet.
right. Yeah.
And those types of quote unquote diets are hard to maintain because they don't change your permanent eating habits often.
Okay. Yeah. I think you're right. I mean, I've been on that, but it is a high fat diet. And so, yes, I think you're right. Everybody has to make their own decision, but okay. True.
All right, shifting gears. So we talked a lot about body. Going to shift a little bit to mind. and your mental health as you age. Especially during, we've had a couple challenging years here with being in a pandemic, a lot of us experiencing isolation, a lot more stress and anxiety maybe than even
Right.
we have been used to before. Do notice if you're uncharacteristically irritable, anxious, or sad. Um, Recognize that challenges with anxiety and depression are normal potential challenges with getting older. And
Hmm.
that's could be due to factors that are just in your um, as part of how you age. Maybe you've lost somebody. Maybe you have been having to provide care for a loved one, and that's become really challenging.
Hmm.
And maybe uh, and your brain does change as you age too, and sometimes you become it's easier to become really anxious. Maybe you're noticing that you get anxious a lot quicker than you used to when you were younger. Those things are normal for to be occurring when you're getting older.
And you know what? I think that is so important. What you just said is that I think as we're all aging, that we need to accept that and not get all hung up on, that we shouldn't feel that way. We really need to understand that we are getting older and things are happening, and just, try to accept it and be positive and, whatever. So,
Yeah. Often when I talk to my patients about this, I say, usually what I hear people say is they want to continue to function and they want to continue to be the best version of themselves, right? And
yeah.
so sometimes you're having trouble doing that, and that's just because you're aging, and we can talk and work on that.
Hmm. Hmm. Yeah, I have to tell you, my dad lived to be 105 years old, and he was very healthy right up to the end. And the whole lesson he taught me was he was so positive about life. He was just really, so, his mental attitude was so great, so positive. But, he was healthy too, so that makes a difference.
Yeah, and identify those in your life who you can talk to, who you trust,
Yeah.
and talk to a doctor or a therapist. It doesn't just
Mhm.
have to be a doctor; it could be a therapist. Uh, and use resources to help you continue to be that best version of you.
That one is so important, so important.
Things to avoid: thinking you can do it alone or fix yourself. Um, a lot of times, or shaming yourself for having challenges in this area.
Hmm.
And
Yeah, that's a big one. That's a big one, shaming yourself. We all do that. I mean, it's, ugh, well, I don't mean we all do it, but a lot of people do it. It's like, that's a big one, Dr. Downing, is shaming yourself. That's
and
so
there's
easy to do.
yeah, and they're common. These are common symptoms of
Hmm.
mental health issues or depression, especially is
Yeah,
the self shaming or thinking you won't or can't get better.
right. Those are good ones. I like those.
Sleep. First, recognizing it's normal for your sleep patterns to change as you age. So, your sleep may be different than when you were younger, for sure. And it could be more sleep or it could be less sleep on either end. Things that can help with that: working on a good sleep routine. So, having a consistent bedtime, having a consistent set of activities you do before bed. Safe sleep supplements like low dose melatonin. You can consider that if you're having trouble sleeping after talking with your doctor about it and making sure that it's safe with any other medications that you take. And then giving yourself permission, if you are one of those people who are noticing that you're sleeping more, to take a nap in the afternoon. Sometimes people just need permission for that it's okay.
How long of a nap?
Usually like 30 to 60 minutes.
Okay.
Things to avoid. I mentioned this one before in when we were talking about bladder health. Drinking fluids in the 2 hours before you go to bed. that can help reduce the number of times you may have to get up to go to the bathroom. Avoiding caffeine after noon, so trying to keep all your caffeine in the morning. And then avoiding over the counter aids that include Benadryl. So, most things at the drugstore that have the term PM in them, the PM means that they've put Benadryl in the medicine.
Oh,
Um,
gosh.
yeah, and that really isn't a great sleep aid when you're getting older, if you're over
Mhm.
65. So,
Well, let me ask you this. So I'm having trouble with my sleep, but but I still sleep like 8 hours, but I have to go to bed, like at 8:30, but then 8 hours is like waking up at 4:30. And that is really early. And I try to stay awake until 9, and then I wake up, at 5. So is it if I'm still getting, like 8 hours of sleep at night, no matter what time that is that okay?
that's perfect.
Okay.
Yes.
All right, good. Thank you.
All right, cognitive health. Keeping that brain and memory strong. So again, recognize some cognitive changes are normal with aging. It's normal for you to mix up names of people sometimes. Like you call people maybe the wrong name, or you can't recall a name as quickly as you did before. It's normal not to be able to remember things, like maybe you said, gosh, I used to be able to, someone would tell me a phone number and I could just remember it. To not be able to do that anymore. It's normal to notice that the speed that your brain functions at might be a little bit slower. Um, Keeping your brain, ways that you can help keep your brain active: read, puzzles, card games, dancing. It's a great activity for keeping your brain active, and definitely interacting socially. If you're having trouble with your memory, talk to your doctor about it and talk to your family and your loved ones.
I have heard that before, the dancing, and I know a woman that lived to be well into her upper 90s, and she danced all the time, but I read that someplace where the dancing, the connection between your thinking about where your feet are and the brain is just really good.
Yes, it is. And it works, you have different parts of your brain. And that
Mhm.
dancing really is good at connecting like the balance part of your brain in the back with the cognitive part of your brain in the front.
Mhm.
And so it's a really great, yeah, it's a really great brain activity.
And
And
then puzzles. I
fun.
mean,
Can be fun.
yeah, puzzles. I mean, that I never thought about that. My husband does puzzles all the time. I don't have the patience to do puzzles because I can't figure out how to put those little pieces in the right spot. But listen, I was that way when I was 35, so I don't think it's an age thing. But I think that's fabulous that puzzles, because I that's a fun way to keep your brain working. I know the reading is good. I understand that, but I think that puzzles, that's a good one.
And it could be, it could be the physical puzzles, also can be word puzzles,
Oh, okay.
all sorts of puzzles, just puzzles
Okay.
in general. So you can find a puzzle that works for you.
Yeah. I'll work on that.
Yeah. Things to avoid. So sedentary activity for both your body and your brain. So, just like we tell our kids to kind of, or attempt to tell our kids to restrict screen time, that's just as helpful for older people too, or any person, in fact.
Yeah.
Um,
What do you say, like every hour, get up and walk or something?
yeah, yep, definitely. And then just getting back to, you know, thinking about activities, right? Doing things like dancing, doing things like that we talked about with exercise.
Yeah.
Having a good routine around that stuff. Probably more important than getting up to walk every hour, but having a good routine where, every day you do something that's a little bit more physical.
Oh, okay, good. All right.
Blaming yourself if if your memory is struggling or you think you're having issues. Um, Too much alcohol, and as you age, you're still at risk for overuse of substances. And often, if you're coping with something, you're likely to turn to a substance to help you. Medications that can it can affect your memory or your cognition, and that's something to talk with your doctor about. And one of those pills can be taking a sleeping pill every night that has Benadryl or something in it.
Yeah, that is such a good tip. I can't tell you that Benadryl thing. That is a really, really good tip. Okay.
And then avoid delaying getting help if you think you're having trouble.
Yeah.
All right.
Aha. Here we go.
We keep getting meatier.
Yeah, this is getting very yeah,
Uh,
exciting.
Sexual health as you age. Uh, no one should be ashamed to be sexually active at any point in their life. Um, Things that you should do: continue to be sexually intimate in ways that work for you. That may change as you get older, but in ways that work for you and your partner. Get help, seek support if you're having physical or psychological concerns about sex. Um, and then always make sure to practice safe sex if you're with a new partner. Um, that may not, especially if you've been in a long-term relationship and now are, lost somebody or went through a divorce. You may not be thinking about that.
And there's so many other ways to experience sex besides just the regular kind
Yeah, absolutely.
intercourse. I mean, there's other things that you can do that I think it's important for women to check out,
Yes, absolutely.
like the
And
vibrator.
that's right. And those are all totally right. Those are all part of human sexuality, right? So,
Yes, yes.
um, and there, don't avoid talking to somebody if you're in an intimate relationship or your mental health is suffering due to sexual concerns.
Mm-hmm.
There are great resources that will talk about all different topics about sex with partners, your own personal sex life, um, and don't be afraid to explore those things.
Mm-hmm. That's a good idea.
All right, community and social health as you age. Great to stay active in your community, for sure.
Yeah.
Um, right now, uh, one of the biggest, important ways to do that is to get your COVID vaccine,
Mm-hmm.
and now get your COVID booster if you're eligible based on the vaccine you got, so you can continue to be safe in your community.
And yay, I just got mine.
Wonderful.
Yeah, I'm
Congratulations.
excited. My booster.
And then the other one here is just talking to your family and your friends while you're still self managing about your financial health and your overall health care and your goals around your health as you age. Try
Mm-hmm.
to try to avoid delaying that. I know it's hard to talk about that kind of stuff, and to bring it up and find time and space for it, but it's important to do so.
Well, I tell you, I mean, you're still so very young, but I'll tell you, when you grow older, it's just hard to think about the fact that you are getting older and that you do need to get things in order. And, because mentally you still feel so much younger. So, yeah, it is just so important to do that.
It is. At the very one of the biggest blessings of my life was my grandmother, and I called her my person, and remembered having some of these conversations with her. She's passed away now, and helping, just because we were so close, we had the opportunity to have real frank conversations.
Mm-hmm.
And being with her as she struggled to recognize that she was no longer going, wasn't going to be forever, that she was going to be independent.
Right. My doctor says, I have a young doctor, but she says, even though no matter how young you feel mentally, which I do feel very young, she said, physically, your body is aging, and that's happening no matter what. And so you need to recognize that and deal with it. So, yeah, thank
Yeah.
you for bringing that up. That's really important.
And then the other one I just put on here is just not asking for help if you're caring for an ill loved one or experiencing significant grief. Using your community support uh, is very very helpful in that situation for you and whoever you're caring for to continue to be well.
Hmm.
That's a really hard one too.
Yeah, that is.
Really hard.
Hmm. The whole aging thing is, it is a challenge, and that's why I keep talking about, you just mentally, we put a post on our Facebook page the other day that said, some days you just have to make your own sunshine. And I thought, that is so good, isn't it? I mean, even though we're aging and we have to think about all these things that you're talking about, and there's so many things there, and you've given us so much information, but we just still have to keep making that sunshine, to keep going, because we can't let it, get a hold of us and take us down. So,
Yeah. And the good thing is you should have had many years of practice at making your own sunshine. So
yeah,
keep
yeah,
that skill going.
yeah, I have had, yeah.
Well, thank you so much for having me. And
Oh my gosh. Okay, Dr. Downing, how
yes,
can somebody, you have a practice, right?
I actually don't have a practice anymore because
Oh,
I do
you
all
don't? So
this
people can't
leadership
get in
stuff
touch with
now.
you? Can they not get in touch with you then?
We do have a number of excellent geriatricians that
Okay.
are in our community, and I'm not the only one. And so, if you're looking for a geriatrician, you can definitely access some recommendations through Alina Health on our website or through accessing our call center.
Okay, and is this, you've got this here, alinahealth.org, whole way to better. What is that? That takes you where? I mean,
Yeah, that takes you to our homes, just our home page. The AlinaHealth.org website is where you can
okay,
find information on specific providers who specialize in geriatrics. And
okay,
Whole Way to Better page just talks more about Alina Health and our vision for healthcare
okay, all
going into
right.
the future, especially our whole person care, mind,
Hmm.
body, spirit, community approach to care.
Yeah. Oh my gosh, this was so good, and I loved having the slides and being able to follow and read those. What such good information. Thank you so much for this. We need to hear these things, and we need to hear them over and over and over. I mean, everything you touched on was like things that I certainly, have dealt with, and I know a lot of my friends. So, I love that. That was just a great slide presentation. And you do look like you're 27.
You're too kind.
You do. You look like a child. No, it's like, I do think a lot of times the young people don't understand, what, the whole aging thing is about, and, because you're not there yet. But I
Definitely.
also think the young people are really helping us, because they are so kind. And as you age, they're really kind to you, and they're really, they just they're just really nice, and they really pay attention to what you're doing and what you're going through. So, I mean, I'm very optimistic about the young generation. They're really treating us well. So
Well,
thank
thank
you
you so much.
so much. You are just a delight, and I just appreciate your time and telling us all these wonderful things and these subjects. So thank you.
Take care. Have a good day. Bye.
Okay, bye.